Happy Perioperative Nurses Week. Thank you so much for tuning in to this spotlight series where we are taking a look at perioperative nurses from across the globe so that we can celebrate the role of the perioperative nurse no matter where in the world they may work, but also so that we can get a glimpse of what it's like to be an OR nurse somewhere else. For our first interview of this week, we are starting in Selma, Alabama, actually, but we're going to take a trip across the pond and learn more about OR nursing in England with Helen Evans. So, Helen, thank you so much for joining us today.
Well, thank you, Melanie. Thank you for having me.
I'm so excited to get to talk to you now. Full disclosure, Helen actually is my director at the facility where I work, but obviously you can hear in her accent that she is not from the South. And so it was a quick connection to be like, hey, let's find out a little bit more about you and what it was like as a nurse in England. So you were the first one that I wanted to interview for this week. But why don't you just go ahead and just introduce yourself to everybody?
Well, thank you. I'm Helen Evans. I'm currently the Director of Surgical Services and the Cath Lab at Vaughan Regional Medical Center, Selma, Alabama. I've been in that position for 3 years. I've been a nurse, a registered nurse, for 36 years. It's kind of scary that it's been that long.
The numbers
Time flies.
add up quickly.
Yes, it does. And so I've been in the United States for 34 years. Came here when my son was 1 year old, and he turns 35 this year in October. I married someone, an American serviceman in the Air Force, 36 years ago. Yes, right after I graduated. And he lived in England, obviously, for a while, for about 6 years, and then we came back to the United States. So I've lived and worked all over the United States, in Nebraska, Washington, D.C., Florida, and then Alabama, which is where he's from. So that's how we ended up coming back here and retiring.
You've been all over the place. And
Yes.
It's interesting to hear too that so right after you graduated, you married an American and then ended up immigrating to the United States. So I want to kind of hear all of that. But you did nursing school in England. So what was
Yes.
nursing school like for you in England?
So back in 1988, when I graduated, it was the BSN program was a 3-year program. And to be a state registered nurse, that was the title. And so it's changed since then. But when I was training, you did clinicals, and then you went to work in the area that you were studying in clinicals. And you also got paid while you were in training. It wasn't very much, but you did get paid.
Better than nothing.
Which helped with all your fees, for the college. And I trained West Suffolk School of Nursing, which was in Bury St Edmunds, Suffolk, which was about an hour from where I grew up. And I just loved it. It was an excellent school. We did some work with Cambridge University as well. And I was exposed to a lot of different specialties. The hospital I worked at was actually a showcase hospital for the National Health Service in England. And it was, funnily enough, viewed by many American hospitals would come over to take a look at the design and the way they functioned, to take back to the United States to design their hospitals around it.
That's really cool. So when you were in nursing school, the way that the nursing school was set up, you would have classes, you would have clinicals, and whatever particular specialty, whether it was med surg or labor and delivery, pediatrics, whatever, they then put you to work. And so you actually work in that specialty for a certain period of time.
Yeah. So I think it was usually about 3 months we were in that area. Wow. So we did labor and delivery, pediatrics, med surg, psychiatry, the OR. The OR in England was called the surgical theatre.
Very
what it was named after. Yeah. And I'm trying to think the other specialties, but we got a good variety in those 3 years.
Definitely. But and then to also be put to work. So it's not like my experience in nursing school, we showed up and we did our like 8-hour clinical 1 day a week and we kind of did a few things and we were put to work, but we weren't working shifts and really getting to see what it was like until we got out of school. So I think that really gave you a good perspective for what you were getting yourself into, right?
And it truly helped me in my final exams because I was able to recall an actual patient that I'd taken care of.
Yeah,
and that doing things helps me remember things more than just reading books. It made more sense, you know, you could think of a patient.
Absolutely. And you got to work in the OR, and you told me before you always wanted to be an OR nurse. So you went right to the OR out of nursing school, right?
Yes, I did. And that was my first job as a staff nurse. And yes, it was very different from how it is over here in America. I think also it was because of the year, you know, 1980s. There wasn't all the disposable things that there are now. It was all reusable. And I had to learn how to, you know, clean and sterilize the theater gowns and masks and hats that all the surgeons wore. And that was something that had to be done at the end of the day. And as a new nurse and a student nurse, that was my job to do all of it and help sterilize all the instruments. Yes, that was a big part of the day. More time was spent doing all of that than actually in the operating room.
Interesting.
Actually.
Interesting. Yeah, I think we've interviewed some different people on the podcast talking about their experience, and they talk about doing it that at the end of the day and getting everything re-sterilized, ready for the next day, getting the linens for the back tables and stuff, you know, sterilized, all that. And it's interesting to think about what we take for granted with all of our disposable packs and everything that we just open and we're done. And back just a few years ago, people were getting those ready each day and sterilizing.
Yeah. And not having the vast variety of instruments. So it really slowed the day down because there would be a pause between each case while we got instruments ready.
Oh, okay. That's interesting. Yeah, you didn't have the gigantic storage room that just had row after row of trays.
No. And there was, you know, of course, no EMRs. It was all paper charting with carbon copies on it, you know, to make enough copies for all the different departments.
Well, I might be dating myself a little bit too, but when I started in the OR that I started at was also still on paper charting, and ours was a triplicate, and you would pull it apart and do your, you know, file it where you had to. So I can still at least commiserate with you on the paper charting and the triplicates, because that was certainly something that I had to do too. But I'm curious, you didn't stay in England, you immigrated to the US and then began to work as a nurse in the US. So what was that like? How did you go from being a nurse in England to a nurse in the United States?
Yeah, so it was quite lengthy. I had to take, or it was recommended I took the CGFNS, which is Commission of Graduate Foreign Nursing Schools. And it was a multiple day exam. I got tested on my English language because it was for all foreign nursing students, not just English. That was one day. I had to travel for over an hour to London to take it because there was only set exam places. And then another exam was testing you on your nursing knowledge. But it was quite basic. My memory of it wasn't comprehensive nursing. It was quite, you know, basic things. It was very expensive. You know, we were newly married. We didn't have a lot of money. I remember it being several £100. And then also for my immigration, I was fortunate that I was already married to an American, and for over a year, we'd been married. So it was easier process to get a green card, resident green card, to come over here. And it also helped that I had a profession of nursing that could be utilized in America. That helped speed my green card process because I had a skill set to offer them. That definitely helped. But that was an expensive process too. That was, I remember, over $800. And that was a lot of money to come up with.
That's still a lot of money. I would be looking at the hundreds of dollars to do all of that. So when you got to the States, did you have to take the NCLEX or did you have to take anything again?
I did. I had to take the NCLEX. And at that point, we were in Omaha, Nebraska, and it was a 2-day. So I had to, and it was a long way from where we lived. So I had to stay in a hotel. Yeah. And I can remember studying in the hotel between the 2 days and just figuring, I don't know why I'm studying. It's too late, you know. But at that point, I had graduated in England and been in America for about a year before I went back to nursing, because I'd had my son at that point. So I took about a year off. So I had graduated from England for, I think it was 3 or 4 years. So I can remember going to the library every weekend for months, studying the NCLEX and taking the practice tests and getting, you know, back into that frame of mind of nursing again for every weekend, every opportunity I had, you know, to go. I'd go to the library to get away from the house and my small child so I could concentrate. And yeah, it was a lot. The biggest thing for me was all the medications were named differently.
Oh,
So I had to like relearn everything. And the dosages were all different. And that was the biggest thing for me, was learning the medications and dosages.
Wow. Well, that actually transitioned me to the next question, really, that I was going to ask, because you had worked in the OR in England, and then when you had gotten your NCLEX and you began to work in the States, you walk into an OR. Was it the same? Was it different? Were you just shocked, or what did it kind of feel like home?
Yes, it was very different, very different. Everything about it was different. I didn't go immediately into surgical nursing. I went into other nursing to begin with, but when I got in, I actually did a perioperative nursing class to kind of get myself back into it. And we were taught, you know, how to circulate, how to scrub, how to first assist. It was a 6-month program. It was pretty comprehensive. It was invaluable for me because things were totally different from when I had been in the 1980s and 90s in it, and plus a different country. It was a lot of disposables. They didn't have an EMR. We were still on paper chart, but there was a lot more in-depth charting for legal reasons was already introduced. There was more staff in the department than I was ever used to. The physician to nurse interactions was completely different from how it was in England.
Was it a positive difference or a negative difference?
Yes, it was positive. In England, the surgeon was to be respected. The surgeon, it would be Mr. Evans, not Dr. Evans. Once you became a surgeon, you were no longer a doctor, you were a Mr.
Really?
Yes. So I would have terrible problems with saying, you know, talking to the surgeon in America and be saying Mr.
Oh, yeah, because
Mr.
and
Smith, you know,
and not, if you said that
and
rather
they would look at me, I'd like, oh, I mean doctor. I'm sorry, doctor. And there's more staff, you know, we were very short of staff in England. There was always been a nursing shortage, even back in the 80s. It's even worse now, is my understanding. We didn't use nurse anesthetists. It was always an MDA that gave the anesthesia in all the cases. If you had one, you'd have one scrub tech, and that would be it.
Yeah. Wow. Yeah, there's a lot of differences. I think I don't know why it makes me laugh to think about how the progression from the title of doctor to the title of Mr. being a surgeon. But that is so different to our culture here. I think that's just a lot of fun, something new to learn. So what about, I know that you speak English and spoke English in England, but there are some words we say differently, and there are some differences between the States and in England. Did you find that there were any language differences within the OR, maybe with instruments? You already mentioned medications, but were there other things that just surprised you when you were over here?
Yes, there were a lot of name differences, and that with the instrumentation, and that's why that was one of the reasons I took a perioperative class, because I was concerned about that. I'd already found all the medications were different,
Right.
so that's when it became apparent that there was going to be, even though I spoke the same language, there was going to be some big differences, and I wanted to be prepared for that. And I just remember there was, going through a perioperative class, there was so many different trays,
Mm.
that was a lot to get to grips with. There was more generalized trays that were utilized in all the different surgeries. I mean, there'd also been, with that length of time, changes in how we did surgeries. More complex surgeries were being able to be done on a more regular basis, even in small hospitals, than that they weren't being done back then. There was no laparoscopic surgery in the 80s.
Right. Everybody was opened up.
You needed your gallbladder out, your appendix out. We're going to open you up and take it out. So that was a big difference. Learning how to use a laparoscope.
Yeah,
Things
definitely.
like that.
So this has been fascinating, and I feel like we could just sit and talk and compare for hours, but we don't want to keep you any longer or turn this into a full day session. But I am curious, before we go, because we are celebrating Perioperative Nurses Week, do you have any advice or encouragement that you can share with other nurses who are watching today?
Yeah, I think ask questions. Most surgeons, doctors love to educate. The amount of training they've gone through, they had to have enjoyed education. I think that's why they've gotten into it. So I encourage all nurses, show your interest to the surgeons, ask questions. It's really important for you to understand the whys we do things, because there's always an explanation for that, and choose a specialty that is the most interesting to you, and work on that. Study in your spare time on it so you can learn the anatomy is really important to understand. And ask to get right up there with the surgeon and watch what he's doing. Offer to hold a retractor or something, but get right up there.
Absolutely.
I would
Don't be
definitely
afraid to jump
encourage
in.
that.
Yeah, definitely.
Yeah. And then also remember that, because in the operating room, we've covered the patient up pretty much completely other than one area. Remember that's a person there. Remember
Yeah.
that could be a family member, a neighbor, a loved one. And just remember that, when you're taking them to the operating room and afterwards, and then when they're in there, remember their families waiting outside for them and how scared they are. We're so used to the operating area. It's every day for us, but it's not for them. And it can be very scary, time for them. So offer them reassurance and, call out there and let them know what's going on, that, they're in good hands and everything's going to be okay. That's when I've been on the other side of things, when I've been waiting for my husband or my child to be operated on, that's meant a lot to me to have someone come out or call out to me on the phone and say, things are going well, we've just started, and it's all going okay.
Yeah. That peace of mind and that assurance goes
Yeah.
along when you are the person who has the loved one that's on the table. And
Yeah.
remembering the humanity of every single patient that we see, and not being afraid to just jump into the mix and learn and ask questions, all of those things. That is such great advice, and things that even experienced nurses can be reminded of, to say, yeah, that's right. I might not know this new procedure, but I'm going to jump in there and learn it and ask questions too. And those apply to that type of advice, applies to all of us. So Helen, thank you so much for joining us today and sharing your experience with us.
You're welcome. I've enjoyed it. Thank you for having me.
This was so much fun. And that is going to do it for today's Spotlight. Tune in tomorrow as we go around the world and interview an OR nurse from New Zealand. Don't miss it. I'm your host, Melanie Perry, and on behalf of our whole team, thanks for tuning in to First Case.